What is nebulizer therapy? A nebulizer is attached to a flow of air or oxygen, converts a solution of a drug into an aerosol for therapeutic inhalation. Assessment. Evaluate patient needs for nebulization. Evaluate arterial blood gases, sputum cultures, and chest x-rays. Review the physician's nebulization order for length of treatment and medication to be used. Assess patient's lung sounds before and after each treatment. Observe consistency, amount, and color of expectorated sputum. Assess need for additional physiotherapy to improve respiratory function. Assess pulse and respiratory rate to establish baseline data. Objectives: to deliver aerosol medications, to promote a better ventilation or perfusion ratio by increasing bronchodilation and alveolar ventilation, to prevent or treat atelectasis, to administer mucolytic medication to lower the viscosity of the secretion and aids expectoration, to decrease pulmonary edema, to deliver an antibiotic to a patient with chronic purulent infection, example in cystic fibrosis, to decrease the work of breathing, to administer bronchodilators for the relief of bronchospasm associated with respiratory diseases, example asthma and chronic obstructive pulmonary disease or COPD. Special considerations. The medication as well as its administration by air or oxygen is prescribed by a medical practitioner. It may need to be diluted with 2 to 3 ml of normal solid and is normally prescribed 3 to 4 times a day. The procedure may be coordinated with GIS physiotherapy and may be administered by a nurse or physiotherapist. For a patient with asthma, an estimation of peak flow of tidal volume may be recorded before and after nebulizer therapy. Main types of nebulizer. Jet aerosol nebulizer uses gas under pressure. Ultrasonic nebulizer uses high-frequency vibrations to break up the water or particles. High flow. Equipment. Mouthpiece or appropriate oxygen mask, example, a Hudson mask. Prescribe air supply, pipe in cylinders or via portable air compressor. Adapter, nebulizer apparatus or machine. Prescribe medication if dilution of drug is required. Sodium chloride 0.9% normally being used. Sputum gather equipment. Check medication order against original physician's order according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. These comparisons help to identify errors that may have occurred when orders were transcribed. The physician's order is the legal record of medication orders for each agency. Know the actions, special nursing considerations, and safe dose ranges. Purpose of administration and adverse effect of the medication to be administered. Consider the appropriateness of the medication for this patient. Perform hand hygiene. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Hand hygiene deters the spread of microorganisms. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in the medication area. Organization facilitates error-free administration and saves time. Transport medications to the patient's bedside carefully. and keep the medication in sight at all times. This is because careful handling and close observation prevent accidental or deliberate disarrangement of medication. Identifying the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. This is because identifying the patient ensures the right patient receives the medication and helps prevent errors. Explain procedure to the patient. This is to gain cooperation and allay anxiety. Fill the nebulizer cup with the ordered amount of medication. This ensures that the required medication amount is given. Turn on the air compressor. This is to ensure the efficient vaporization of the medication. Observe the fine spray from the nebulizer. This is to check that the equipment is working. Encourage the patient to breathe the nebulized vapor through the mouthpiece. This is because breathing through the mouth or normally with a mask helps the medication travel to the lungs for maximum effect. Remain with the patient until all the solution has been nebulized. Instruct the client to continue the treatment until he or she can no longer see a mist and exhalation from the opposite end of the mouthpiece or vent holes in the mask. This is because lack of mist ensures that the client has inhaled the entire dose. Encourage the patient to expectorate, as the medication may help to loosen the bronchial secretions. Ensure that the patient is left feeling as comfortable as possible. Bronchospasm is further reduced if the patient is relaxed and reassured. Wash and dry the nebulizer, tubing and mask or mouthpiece with warm soapy water. Proper cleaning decreases the possibility of pathogens entering the client's respiratory tract. Retain the equipment in a polythene bag. For the patient's next administration, to prevent infection, the equipment should be changed every 24 hours. Document the nursing practice appropriately. Monitor adverse effects and report any abnormal findings immediately. To ensure safe practice and enable prompt, appropriate medical or nursing intervention to be initiated. Evaluation. Increased expectoration of secretions occurred. Patient experienced less labored breathing. Lung sounds improved. Aerosol medication administered into deep air passages and ventilations improved.